Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Today's topic is one that I see a lot on the internet, and I get asked a lot of questions about it. And a lot of people are confused and think that they're doing what we do when they're not, even when it's done by a healthcare professional. And that's when they try to pop their own spine, quote unquote, pop their own spine. I've seen it with personal trainers. I've seen it with even martial arts instructors. I've seen it with physical therapists, and I've even seen it with athletic trainers. They will try to quote unquote pop the hips, and somebody will come in and say, my usual person isn't able to pop my hip anymore. What they'll do is they'll lay them on their side, kind of like we do a side posture adjustment. They'll pull really hard and get a popping noise coming out of what we call the SI joint. The SI joints where the tailbone, the sacrum, and the ilium, the hip, come together, and they can twist somebody and make it a pop. There's an endorphin release, and people think, oh, that's exactly what my chiropractor does. And I'm here to tell you that is not exactly what your chiropractor does, not by any means. So they think because it sounds like what the chiropractor does and it feels a little bit like the chiropractor does that they've already been taken care of. So they'll come in and tell me one of the above was putting me on my side, they were popping my hip, they don't seem to be able to get it anymore, and now I'm having a lot of lower back discomfort and pain, can you help me out? Let me describe a little bit what happens when you quote unquote pop your own neck or pop your own back or crack your own neck, crack your own back. As chiropractors, we usually start off with taking x-rays. And we take your x-rays so we can see which bone's most misaligned. We call it subluxated when it's out of alignment, creating pressure on the nerve, interfering with the nervous system. And chiropractors are trained to find these misalignments and do a vertebral adjustment to correct these. Now we also do examinations. Maybe you'll have you turn your head certain ways, or bend your feet certain ways, or look the way you lie. We use our fingertips a lot just to feel up and down your spine to see what we can feel. And our goal is to find the one that's most fixated. Now when you go to quote unquote crack your own back or pop your own back or have a friend do it, what's happening usually is you're finding the ones above and below have become hypermobile, meaning they're making up the difference. Because when two bones are out of alignment, what they'll do is they'll actually lock up and get stuck. And that's what a chiropractor's unique training is, in order to figure out the correct line of drive, the correction and angles in order to go in and break that fixation. But when you just grab something and just grossly try to manipulate it, make it pop or crack, usually what you're doing is you're moving the ones above and below, making them make a noise, causing the one in between to get more stuck. Now this is often very obvious in the neck or cervical spine. Somebody will come to me and say, I usually pop my neck every day, it feels good, I do it 3 or 4 times a day, but lately it stopped going and now it's getting really tight, I'm having a hard time turning my neck. What's usually happening is they've got 2 of them now totally locked up and the ones above and below hypermobile. So not only is this one really stuck, but the ones below are moving double extra, which makes this one really stuck extremely hard to adjust. So you've really taken a situation that made it bad and actually made it worse. So as a chiropractor, we'll have to seriously get in there and really move you around and be pretty aggressive in order to break that loose. And often patients describe this as being uncomfortable. They don't really care for it. But they've put themselves in this situation where it's made it such a challenge for the chiropractor to do it. Again, when they do it themselves, there's an endorphin release, so they said, oh, it feels good, so it must be good for me. I always talk about ice cream sundaes. They always feel good when I eat them, but I know they're not good for me. So when you try to pop your own neck or pop your own vertebrae, you're often getting 1 or 2 more really stuck and making it a really challenge for the chiropractor. Another thing we'll see as we go down the spine, the thoracic spine, a lot of times I'll see a lot of youth do this. They'll cross their arms across their chest and have somebody pick them up and bounce them and try to get the rib cage area or the thoracic spine to make popping noises. Now, anytime you go to a chiropractor, you'll find out that we put you in the opposite position to take care of these joints. We lay you down, have your shoulders come down, and open up your thoracic spine. This is going backwards and actually jamming the joints, having you jump up and down and jam the joints. Now again, the same thing's happening. The ones above and below are moving extra, and the one that's fixated is getting more and more stuck. And these will eventually affect the rib cage too, because the ribs articulate between two of the vertebrae. When these vertebrae start to get stuck, that rib starts to get stuck too. Now you're having pain going around the rib cage as well. Again, this is really just a bad idea, especially if you do hurt and you have somebody do this, because they're really jamming the joint up even more, creating more inflammation and more pain. Again, there'll be a little endorphin release, so people say, well, it feels good, so I figured it was good for me, but I assure you it's not. Lower back, same story. But let's go back to my original talking about making your hip pop. Somebody puts you on your side and make your hip pop. Your hip doesn't randomly just get stuck. Your hip doesn't randomly just have a problem. There's a thing called the righting reflex, and the righting reflex says that no matter what, your eyes stay level at the horizon. Otherwise, you lose your equilibrium, you lose your balance, you have blurred vision, and you'll have slurred speech. Your body has to keep those eyes level at all times. So if you get a kink in your lower back, usually your hips counter twist to keep you balanced. Now, I've had a couple athletes over the years that they said they usually pop my hips, but they're busy today, can take a look at me. And I don't even usually have to touch their hips. I always find their upper lumbars out. You see, the L1, L2 have a muscle on the front side that travels down and splits and goes into both of your groin, into your femurs, your leg bones. And what happens a lot of the times is your L1, L2 will turn left or right, and this will take that muscle and make it really tight. You might have some groin pain on the front side, and what it does is it lifts and twists and turns your hips to balance you back out again to keep your eyes level with the righting reflex. Now this right here can cause the piriformis muscle, the muscle you sit on, to get really tight, angry. And when that muscle gets really tight, it'll hit the sciatic nerve and it mimics sciatica. It's actually called piriformis syndrome, but a lot of people mistake it as sciatica. I've done several podcasts on this topic in the past, either piriformis syndrome or sciatica. You can go and see the difference of them. But the more you crank on that hip and trying to make it pop, and that lumbar spine's still there, the angrier you're getting that muscle on the front side. And that's when people really tell me, not only does the person pop their hip, but now they're getting some groin pain on the front side. I already know what's going on, is that L1, L2 is getting more and more locked up, more and more twisted, creating more and more pressure on that hip flexor muscle, which continues to pull the hip out more and more, and the person gets addicted to having somebody pop it all the time, and they think they're correcting it because they'll get brief relief, but they're really causing that upper lumbar to lock up. Now the nerves that come out of the upper lumbar, they innervate your groin, the front of your femurs, your front of your legs, not the back side, not the sciatic area, but that side. So it also can create some discomfort in that area as well, neurologically. Lastly, those nerves also go to your colon. So a lot of people complain about bowel issues when this is going on too. So it's very important that you look at the whole spine all together at once. It's also very important you have somebody very trained who knows the righting reflex and the compensations, and the most common, if this one's out, you probably have one out here. If you have this one out, you probably have one here. As chiropractors, we see trends in this, especially once we know your profession, if we're working with your profession. Now, this is really important. Athletes, and I'm picking at athletes today because athletes are the most common ones that do this. You don't see a lot of postal carriers laying on the side of the sidewalk and having someone try to pop their hip. But you will go into a trainer's room or a locker room and you will see people trying to do this to each other, or somebody else doing it who's probably not trained on doing it, but again, they get that pop and they think they got it. So it's very important, if this is something you do, if you know somebody does this, it's time to get your spine analyzed by a chiropractor. And what does that look like? As I alluded to before, you would come into the chiropractic clinic. The chiropractor would most likely take full spine x-rays of you to see your entire spine, because you're obviously having massive compensation areas. Be able to figure out which ones are the most rotated, the most subluxated, to know to probably focus my chiropractic exam on these. From there, you would go through some type of chiropractic examination, whether it's just bending your legs to see what your hips are doing, or having you lift your legs, maybe turn your head left or right, and do different things with your arms and your hands. But it gives us clues of what's going on in your spine based on the way the rest of your body behaves. And it contributes because it all goes back and connects there. So if you have a short leg and I bend it gets longer, I know that hip is out. But why is that hip out? I'll feel the muscles from your hip joints, then your SI joints going up your spine, and usually find the lumbar out. Compare that to the x-ray. Sure enough, the x-ray shows us misaligned too. I'll do a couple other tests in that lumbar, whether I feel it, move it around a little bit, and we'll find out it is fixated, and I usually will adjust that, and then I'll watch the hips a lot of times just self-correct. Didn't have to even touch them. But yet that's the one that they keep getting popped all the time, creating bigger issues. So if you have somebody that's just popping one joint at the other joint, or if you're a physical therapist or athletic trainer or strength conditioning coach and you're watching or listening to this, and you find this happening on an athlete over and over again, you owe it to that athlete to get them to see a chiropractor that will analyze the spine and really get to the bottom of what's going on. Now, you might say, those people allowed to do these things, they'll do a stretch, and during that stretch, if they stretch a little bit harder, they know it'll pop. So even though a lot of strength conditioning coaches and athletic trainers might not have certification in doing this kind of things, they can still do it indirectly, wink, while doing something else. And some physical therapists, are allowed to do these things. They are due to training courses, but I have very limited knowledge of what they're actually learning. Maybe they are learning about the compensation areas, maybe they're not. I can just tell you my clinical experience, typically they are not. They are just making one joint mobilize and ignoring the other joints that could be contributing to it. Again, it's just my clinical experience. I'm not trying to belittle or belittle what the physical therapists are doing, but I work with a lot of athletes and I've seen a lot of things over my time, and I usually find out they're just making one little pop-in noise at one spot. I've been practicing chiropractic for 23 years. I've never seen a person with one spot. Again, why is that? That righting reflex. There's always a yin and a yang trying to balance you out. Only taking care of one and not the other, unless you definitely have the primary. The other one might eventually self-correct. I'm not a gambler. I don't wait for maybe might. I just go ahead and take care of it. So there you have it. What do chiropractors don't like it when other people try to pop their own spine? It's not because we feel like you're doing what we're doing. We know you're not doing what we're doing. We know you're not getting the care we're doing. So we want to make sure that we get a chance to look at you and get both spots. Also, a lot of times people tell me they don't want to try a chiropractic because they've already had somebody pop their spine and they get relief. So if you've been doing athletic trainer, physical therapist, strength conditioning coach, massage therapist that's popping your spine, don't rule out chiropractic. You haven't been to a chiropractor. You haven't tried chiropractic yet. You just have somebody doing what they think is what chiropractors do. Doesn't mean they're doing what chiropractors do. So don't give up on chiropractic unless you've actually seen a chiropractor. Or, like this podcast, if you want to know more about chiropractic or chiropractic care, the only person that you can qualify to answer what a chiropractor does or what a chiropractor doesn't do is a chiropractor. So make sure you always follow up with a licensed chiropractor. If you have a question for me that maybe you'd like me to answer next week, go and leave a comment below, and wherever you're seeing, watching, or listening to this, please subscribe and share. And we'll be back next week with another question. And if you have a question, maybe your question will be the question of the week. Thanks.